Have you ever tried to talk to your parent about something painful they did and they looked at you like you were describing someone else's life? Maybe they said that never happened, or I don't remember that, or you're being too sensitive. And you stood there wondering, am I losing my mind? Because the event you're describing is so seared into your memory. You can actually recall the exact words, the room you were standing in, the way you felt, your stomach drops. And yet, the person who caused that moment seems to have absolutely no recollection of it. This is one of the most frustrating and confusing experiences that adult children describe when they talk about estrangement from their parents. But here's what makes it even more complicated. When researchers or therapists sit down with estranged parents and ask them to tell their side of the story, they often hear something completely different. Not just a different emphasis, not just a slightly altered version, but a fundamentally different story. And understanding why those stories diverge so dramatically is one of the most important keys to understanding family estrangement itself. So before we get into all of that, though, let me just briefly tell you why I'm making this video. I'm a chartered psychologist. I specialise in family estrangement. For over a decade, I've worked with people affected by family estrangement, and it was the focus of my doctoral research. In my clinical practice, I work with both parents and adult children, including families who are trying to make sense of what happened and whether that repair is possible. But more than that, I have lived experience of family estrangement. So it's more than just a professional interest for me. So when I'm talking about this topic, I'm talking from a position of research, clinical experience, and lived reality. And I think that combination gives me a perspective that's genuinely useful and valuable to you. So I want to walk you through what the research tells us and what I see clinically about why estranged parents and adult children tell such radically different stories about the same family. And more importantly, what that means if you're trying to navigate this painful territory yourself. Let me start with something that researchers consistently found across multiple studies, and it's not a vast area, the family estrangement research, but what does show up is when you ask adult children why the relationship broke down, they tend to give really detailed, specific accounts. They describe patterns of behavior. They name specific incidents. They talk about emotional abuse, neglect, boundary violations, a parent's refusal to respect their autonomy, or years of feeling unseen and unheard. Their narratives are often long and layered. They have thought about this extensively. Many adult children will have been in therapy, processing these experiences for years. So they can often connect the dots between the childhood events and the adult consequences. They often have quite a coherent story, even if it's a painful one. Now, when estranged parents are asked the same questions, something very different happens. Parents are significantly more likely to say they have no idea why the estrangement occurred. They describe the estrangement as sudden, shocking, and inexplicable. Now, that's a massive gulf, isn't it? They may even say things like, everything was fine, and then one day they just cut me off. It's not always the case, but that does happen more often than it should. Or they'll say, I don't know what I did wrong. Or they have been influenced by their therapist or their partner. So their accounts tend to be shorter, less specific, and more focused on the adult child's behaviour than their own. Now, that's important. Joshua Coleman's written about this extensively, along with other scholars like Kylie Aglias and Lucy Blake, and they have all documented similar patterns. This gap between the two narratives is enormous, and I see it time and again. So the question becomes, why? Why do parents and children tell such fundamentally different stories? So I'm going to walk you through several mechanisms that might help explain this, and I'm going to sort of bring them to life with examples that I've seen in terms of how they actually play out in families. So the first mechanism is something psychologists call differential encoding. This is a concept from memory research, and it basically means the same event gets stored differently in your memory depending on the role you played in it. So if you were the person that was hurt, your brain records that event with high emotional intensity. It gets tagged as a threat. It gets stored in vivid detail precisely because your nervous system flagged it as something important for your own protection. So that's an important distinction. But if you're the person who caused the hurt, especially if you didn't intend to cause harm, your brain will treat it very differently. It probably might not even register as anything significant at all, and it will pass through your awareness, the way kind of hundreds of other daily interactions or details do, and it won't have the emotional charge that kind of anchors it in your long-term memory. So I'm just going to tell you about a lady I worked with in her 30s called Susan. Susan described a specific incident from her teenage years where her mother screamed at her in front of her friends and told her she was useless and that she'd never amount to anything. And Susan described the event with extraordinary detail. She remembered what she was wearing, which friends were there. She remembered running into the bathroom afterwards, feeling incredibly sick with shame. And this memory had really shaped her self-concept for sort of almost 20 years. When I later had the chance to speak with Susan's mother in a joint session, her mother had absolutely no memory of this event whatsoever, none, zero. I don't believe she was lying. I just think that this moment that had fundamentally altered her daughter's sense of self was so unremarkable to her mother that it simply just never got consolidated into her long-term memory. But for Susan, it was a defining moment. For her mother, it was maybe just another Tuesday afternoon. So the line that matters because it captures something many adult children recognize instantly. The moment that changed, you may not have even registered for the person who caused it. So this isn't always about one person lying and the other telling the truth. It's about the way human memory works. And the person on the receiving end of harm and the person delivering it can have completely different neurological experiences of the same event, which means they form different memories, which means they end up with different versions of the story. That's really important. So the second mechanism is what I call the awareness gap, and it relates to something we call mentalization in my world. And mentalization is the ability to understand that other people have their own internal states, emotional states, whether that's feelings, perspectives, their own experience of what is happening. Some people have a really well-developed capacity for this, and other people really struggle with it. So this is kind of effectively being able to put yourself in someone else's shoes and walk a mile in their shoes. We all know those phrases, don't we? But parents who have difficulty with this often genuinely cannot see the impact their behavior has on their children because they struggle to imagine their child's internal world and experience as separate from their own. So if the parent didn't intend to cause harm, they cannot understand how harm was caused. Their logic goes something like this: I was not trying to hurt you, therefore you were not hurt. And if you say you were hurt, then something must be wrong with you. We might all recognize that. Not because of something I did. That is such an important sequence to understand because that's the logic many adult children are facing or are up against. The parent is not necessarily thinking I caused harm and I refuse to admit it. Often the parent is thinking I had good intentions, so your pain doesn't make any sense to me. And if your pain doesn't make sense, it must be exaggerated, unfair, oversensitive, or wrong. So this is a pattern I see consistently in my work. I remember a father that I worked with called David. He was estranged from his adult son, Marcus. David came to therapy so bewildered by the estrangement. He described himself as a devoted father who had sacrificed everything for his family. And I'm sure that was true. When I asked him to describe specific interactions with Marcus, he repeatedly described situations where he'd been highly critical and controlling, but he framed them as, to him, he was helping or guiding Marcus. So it was only from sort of another perspective. He talked about sort of tearing apart his son's career choices as if he was giving him the benefit of his experience. He talked about, to him, sort of showing up to Marcus's home. He described them as being involved, but to Marcus, they felt like uninvited intrusions. So he was genuinely unable to see these behaviours from a different perspective other than being helpful or well-intentioned. He could only see his good intentions. And because his intentions in his own mind were good, he couldn't understand why his son experienced the same behaviour as demeaning or intrusive. So you see this gap in awareness. It's incredibly painful for adult children because it feels like a second injury. The first injury is the original behaviour, and then the second injury is the parent's refusal or inability to see it. So this is often a big part of the issue, because the adult child cannot tell the difference between a parent who will not see and the parent who cannot see. And that adds another layer of confusion and frustration and harm. So the third mechanism, this is what we might call self-protective narrative construction. So in plain English, this basically means that the mind builds a story that protects itself from that unbearable shame. And for some parents, acknowledging the harm they caused would create such overwhelming guilt, shame, or collapse that their psyche simply won't allow it. And so this isn't a conscious decision. It can be an automatic psychological defense that's operating below awareness. The mind kind of rewrites history to protect the self from feeling emotions that are really, really deeply uncomfortable and painful. And this is something I recognize from my own experience too. In my own family, painful incidents were not remembered the same way, if they were remembered at all. It wasn't simply a disagreement about the details. It often felt like we were living in two different versions of reality of the past, and that's the part that can feel so crazy making for people. People talk about gaslighting, and it can feel like that, because you're not just trying to talk about what happened, you're trying to talk to someone whose entire sense of self may depend on not being able to see your version of reality. And for some parents, admitting that they said harmful things or behaved in harmful ways could mean really confronting something about themselves that they don't feel able to bear. So the memories disappear, they soften, they reverse, or they get reorganized around a story that they can bear, a story that they were loving, or a story where the problem was your oversensitivity or your lack of gratitude, or a story where the injured party and you are the one who caused the rupture. So this connects to much broader patterns that clinicians often see, which is the parent who can't, hold the blame or criticism, but they're also very free to be blaming and critical of others. So from the outside, this can look very hypocritical. And of course, in a way, it actually is hypocritical, but it also reveals something more important about that person's inner world, that they may be functioning from a position of deep fragility, actually, because their sense of self is really very unstable. So any incoming criticism that's towards them feels like an actual real existential threat. So that gets deflected sort of automatically without even thinking. And what happens is they tend to project the blame outward, because externalizing blame is precisely how they can maintain the balance inwardly. Someone else has to be the problem, so they don't have to confront the possibility that they might have contributed to the problem. I'm just thinking of a mother, Patricia, who'd been estranged from two of her three children, and she showed that she showed up as deeply wounded and victimized by the estrangement, and she would frequently criticize her estranged children, calling them selfish, ungrateful, easily influenced by their partners. And when I gently reflected something back to her about her own behavior, even something really minor, her whole demeanor would change. She would become very defensive, tearful, and even angry at times. She told me I clearly didn't understand what it was like to be a mother. And that mismatch was really striking. She could dish out criticism with ease, but receiving just a gentle reflection felt like a huge attack. So this is a pattern that makes genuine repair incredibly difficult, because repair requires the ability to hear the other person's pain without immediately defending against it. The fourth mechanism connects to what is described as the difference between event-based and relationship-based versions of the story. So adult children tend to describe estrangement in terms of patterns. They'll say things like, it was years of this kind of treatment, or there was this constant dynamic where I was never allowed to have my boundaries, or every time I tried to explain how I felt, it got turned back on me. So they see estrangement as the logical conclusion to a long history and pattern of behavior. Whereas parents, on the other hand, are often more likely to focus on this single triggering event. the adult child moved away, they got married to someone who's influencing them, or they started therapy, they had a baby, they stopped coming for Christmas. So the parent will tend to see the estrangement as an event that was done to them rather than as a process that evolved from the relationship kind of over time. And this difference in framing also matters hugely because it determines what each person thinks the solution is. So if you think estrangement happened because of a single event, then you think the solution may be to address that event or undo the event or just forgive and move on. If you just come back to the Christmas dinner example, just stop letting your partner influence you, or just come to dinner, or whatever it might be. But if you understand and recognize that distancing is the result of years of accumulated relational injuries, then you understand that repair requires something much deeper. It requires acknowledgement, it requires accountability, it requires sustained change over time. And when these two frameworks collide, which they often do, both parties will end up feeling frustrated and misunderstood. So I just want to bring in also, there's a cultural dimension to this story gap that I think is important to name, because many parents from older generations were raised in family cultures where parental authority was perhaps more absolute. Children were expected to be grateful for whatever they received. Emotional needs were not really a concept that people took seriously or thought about, and questioning a parent would be seen as really disrespectful in and of itself. So some parents genuinely don't understand why their adult children are so distressed about things that in their own cultural framework were completely normal. They were hit as children and they turned out fine, or their parents said harsh things and they got over it, or did they? Their parents didn't apologize and nobody expected them to. So they may not have a framework or a way of understanding that their children grew up in a different psychological world with different expectations and greater awareness around what emotional well-being looks like. And so this is certainly not an excuse for harmful behavior, but it is a relevant context for understanding why the story gap can be so wide, why this gulf is there. So I want to pause here just to address something because I know some of you are watching and you might be estranged parents, and some of you might be estranged adult children, some of you are both. I'm not presenting this information to vilify parents or to dismiss their pain. Estrangement can be devastating for parents too, and it absolutely is. I've sat with parents in my office who are in absolute agony over the loss of their child. But I also can't pretend that something that doesn't consistently show this significant awareness gap between adult and children, and that gap absolutely tends to be weighted in a particular direction. Adult children are far more likely to have spent years examining the relationship, whereas they're more likely to have therapy, they're more likely to articulate the specific relational patterns that have led to the breakdown or the distancing. And as I've said, parents are far more likely to externalize that responsibility and to minimize or deny the impact of their behavior. Of course, that's not a universal truth, but this is something I see more often than not. And there are adult children who are avoidant or punitive and also not willing to reflect. So, of course, these are generalizations, but there are parents who also do deep work and develop that insight. But so the pattern I'm describing is one that kind of appears more generally in the research and in clinical practice. And so we need to take that seriously. So what does this mean in reality if you're trying to navigate towards some kind of reconciliation or moving on? Well, I'm going to offer a few thoughts here. Firstly, if you are an adult child dealing with a parent who denies or has forgotten harmful experiences, I want you to know your memory is valid. The fact your parent doesn't remember something doesn't mean it didn't happen. Memory is not a shared recording. Two people can have completely different sets of memories of the same event. Doesn't mean you're crazy. It means human memory is complex and self-serving as well. If you're an estranged parent and you genuinely don't understand why your child was pulled away, I want to gently suggest that the absence of understanding might itself be the problem, part of it. If your child just told you they were hurt by specific things you did, and your first response is denial, defensiveness, or to say you don't remember it, then you're probably confirming the very dynamic they're trying to escape. The most powerful thing you can do is sit with the possibility that you caused harm, even if you didn't intend to, even if you do not remember the specific incidents, even if their version of the past is really painful for you to hear. Validation doesn't require agreement with every single detail. It requires the willingness to say, I believe you were hurt and I'm willing to look at my part in that. That is absolutely crucial. And for anyone in this situation, I want to emphasize that understanding why these different stories exist doesn't automatically resolve the issue, but it does reduce that crazy making quality of the experience. Oh my God, it makes you mad and crazy. It makes you feel mad, or you can feel insane. So when you understand there are, really well documented psychological mechanisms that drive this gap, that it isn't imagined, that there's an understandable reason for it, it can become a little bit easier to stop trying to force the other person to see things your way. You can hold your truth without needing the other person to validate it. And you can hold the fact that there are multiple realities, and that can be really deeply liberating. So before you leave, I just want to give you something that I think is the most under-discussed aspect of this entire topic. The story gap between the parents and the adult children isn't always fixed either. It can shift. There are specific conditions under which a parent who previously denied or minimized or avoided harmful behavior can develop that genuine awareness and insight. And there are specific therapeutic approaches that can help to facilitate that shift. It doesn't happen quickly. It doesn't happen easily, for sure. And it doesn't happen in every case, but it does happen. And understanding how it happens may be one of the most important pieces of information for anyone who's still holding hope for a reconciliation. So I'll leave you with this question. If the story gap is what keeps your family stuck, what actually helps a parent to hear the story that they have spent years defending against? What could help them to hear that?